Hey, this is John Hans with the LBL Group, coming to you today with three things to know about healthcare. So recently, the RAND Corporation here in California released some research that they'd done showing the difference between what private payers like health insurance carriers or self-funded groups are paying for healthcare services versus public payers like Medicare and Medicaid, the Veterans Associate, the Veterans Administration, and the Child's Health Insurance Program. And they looked at national data and they found that those private payers were paying 247% of what the public payers were paying. For the same services, accessing the same facilities, holding all those things constant. The only difference was who the payer was, right, between a public and a private payer's identity. And when we look at it on a state-by-state basis, that spread gets even more outrageous depending on the state. California, for example, that's where we're based. That difference was 654%, according to some estimates. And that's just insane to think about, that a doctor's visit could cost someone $100 if they're on Medicare. That same visit could cost $654 to someone just because they're on some commercial health insurance plan. And that's completely unsustainable. And then the final thing I want to talk about is how trying to explain where that spread is coming from is that there's some recent research out there as well talking about how for about every $1 spent on healthcare, only about 27% of it, 27 cents per dollar, ends up getting to the actual provider themselves, if that's the physician or the medical professional. And so I think that explains a lot about where that spread is going, right? That's not increased revenue to the medical group or the physician. A lot of times that's just extra and it's going into the system. So when we're trying to address the healthcare cost drivers in this country, trying to help employers save money, trying to put money back in the pockets of employees so that they're getting the care they need, they're getting the outcomes they need, and they're spending less for it, that's a really good opportunity for us to address. This is John with the LBL Group. If you have any questions, feel free to reach out and I'll be a resource.